Again, there's been a lot of push recently, at least within the last decade, is my impression, for education pathways in academic medical centers for promotion and so forth, really having an emphasis as the clinician educator, and not only focusing on clinician scientists, but recognizing the importance of the education mission of any department in academic medical centers. And I think that that's a big strength, and we have some fantastic educators in this department. You know, you talk about mentorship and so forth. Actually, mentorship, I think that's a good place to go. So you mentioned, one of the reasons, David, that you stayed here was the people that you already knew, your mentors, and I'm sure, Kelly, you also benefit from those relationships, right? So how has mentorship helped shape your career and your decisions?
Yeah, I think, like David was saying, just knowing all of our colleagues so well, just first and foremost, is great for clinical mentorship. So I can always feeling like there's support if you're struggling and need, a second opinion or advice on how to manage a patient. But more so than the clinical work, I think in terms of, academic opportunities, I think, Dr. Ken Shelton, who's our division chief, is really great at just throwing opportunities our way, and I've gotten many opportunities through him of just, I think he does a really good job of trying to keep the new staff in mind when he hears of things that may be available. And that's true not only of him, but of many of the staff that are more experienced that, want to give, these opportunities to people who are just getting started. So whether that's in research or, we wrote something up together for the website, like little things like that, but just including us in a way, because it can feel overwhelming and intimidating, I think, in a department like this where there's so many prolific researchers and just like these really incredible people who are so productive. So to have people give you opportunities is really nice, to not feel like you have to fight for anything. And then even within the department as a whole, outside of the critical care division, I've gotten involved in a lot of the simulation stuff that we do with the residents, and they have a lot of great stuff going on with their educational leadership and programming. And so that's been really fun to get involved with. And I think, there's a lot that goes on within our department. I'm very grateful for that, but it's helpful to find a niche of what you want to do. And there's a lot of, once you have an idea of that, then it's really easy to find mentors. There's almost like too many opportunities and people to help you. There's like, it's like, how do you choose? Yeah.
I have a slightly different, more narrower, I think, focus in mechanical circulatory support. And as I mentioned before, there's not a ton of people, especially anesthesiologists, that do that. And so I have found mentorship, particularly in, the ECMO director here, who, I work with on a regular basis, learn both hands-on in the moment when things are happening, as well as kind of debriefing and doing that kind of stuff after. And at the same time, in a way, helping develop the ECMO, the mobile ECMO division that we're kind of developing here to serve the kind of, New England area, Boston area, kind of outside. And so, as I had already mentioned, this is something that's mostly cardiac surgery that now we've kind of taken on. And so you can imagine that it's well beyond, kind of my baseline knowledge as an anesthesiologist. And so I've relied very heavily on that mentorship to kind of learn as much as I can anytime there's an opportunity in regards to that. That might mean scrubbing into the OR, even though I'm not necessarily a surgeon, to go see what's going on, or, whatever else it may be.